Welcome, everyone. Good afternoon. My name is Michael Ford, and I'm one of the co-chairs of the Return to Campus Committee. So we're glad that you're able to join us today because I'm sure that you're excited and enthused to hear all of the wonderful work that we have put together for you for this information session. So today we're going to get started with just an agenda overview I want to share with you. In a moment, I'll introduce the president. So Dr. Melexide will give a welcome as well. You'll hear from Melissa Hogan, my co-chair on the planning committee, for an overview. And I'll talk a little bit about the facility changes that are taking place. And Dr. Becker, our provost, will talk about academics. Jamar Orr will talk about student life, our vice president of student affairs. And our vice president for human resources, Toya Stewart, will talk a little bit about some of the changes that will take place in human resources. And then we'll conclude with Michael Cassidy, the Director of Athletics and Vice President for Enrollment. We'll talk about athletics, and then we'll go into a Q&A, and I'll facilitate that at the end. So let's get started with Dr. Melexide.
Well, good afternoon, everyone. What exciting times we live in. This is an amazing, nobody would have predicted a few months ago that we would be here today under these circumstances. First of all, I want to thank the two committees that have been working all summer, making sure that we plan for reentry and we can do it safely and with flexibility for all students, faculty, and staff. So today, my introduction is very, very brief. We're going to get a little bit to the meat of the matter and talk about how we will attempt to keep everyone safe, and at the same time, how flexible we need to be as we go forward. So my thanks to everyone for attending today. I know as we answer, when we finish our presentation, there will be a chance for question and answer. And those questions have already been submitted online. We appreciate that. But of course, anytime we have these sort of sessions, it will lead to dozens and dozens of other questions that you will have. So in that respect, get online, fill out the questionnaire so that we can then continue to answer your questions in the COVID-19 Q&A site that we have as we go forward. I just want to emphasize one specific thing before I pass it on to Dr. Melissa Hogan, Dean Hogan. And that is two things we really ask you to do. One, wear your mask. And it's obviously for your own safety, but most importantly for the safety of everybody else around you. We are a social justice campus. Social justice dictates that we care about each other. Therefore, masks are required while you're on campus all the time. And secondly, to make sure that you maintain your social distance. And there will be signs all over the campus directing you to do that. So with that said, let's get to co-chair of our Return to Campus Planning Committee, Dean Melissa Hogan.
Thank you, Dr. Melexide. And thank you everyone for joining us today. I'm really pleased to have the opportunity to talk to you and share with you a number of practices and changes that we're implementing in order to ensure and support the safety of everyone in our community. Before we start, I want to just give you sort of an overview of what our goals were with this Return to Campus Committee. Our first and most important goal is to support the health and well-being of every member of the university community. We are also looking to continue delivery of all of our academic programs in whatever modality is necessary. Ideally, and with our plans, we are intending to have safe delivery of high priority face-to-face classes and labs. We continue our support for every individual who cannot return to campus for any COVID-related reason. And we have also been paying very close attention to and looking to comply with all state, local, federal mandates and guidance. And finally, a very important aspect of our committee is education and outreach across the university community so that everyone understands what is expected. So again, we are following guidance and mandates, guidance from the CDC, the Illinois Department of Public Health, and we're using a really important tool, which is OpenSmart EDU, and that's created by the Johns Hopkins School of Public Health. And it's really taking the public health guidance and the CDC guidance into a very specific guidance tool for universities looking to reopen. So that has been very helpful in us in creating our plans. Some mandates that we are paying very close attention to are the City of Chicago and suburban Cook County travel quarantine, as well as, of course, the State of Illinois Restore Illinois plan, as well as OSHA guidance to keep our employees safe. So some challenges. I know that we're all aware since March that this is a very rapidly changing situation. The information coming out, the science coming out is changing, and the mandates are changing. So that makes it difficult to plan, and we're doing our best, but we all need to realize that things will change, and we can't predict how they will change, but we will change with the mandates, with the guidance, and we will keep you updated as we make those changes. We are, of course, balancing the need of safety for the community with supporting academic progress and success. And we are expecting that every member of the Roosevelt community who comes to campus must comply with all of our new safety expectations. So you're going to hear over the course of this presentation the ways that we are trying to create a safer campus environment and the ways that the different departments and divisions are implementing that guidance. Some specific things you'll hear about is COVID testing required of all students before they return to housing. Daily screening of every person who comes to campus, either via an app or in person if they haven't done it via the app. Reduced capacity across all of our campuses in every campus space to allow for social distancing. Use of isolation, quarantine, and contact tracing when infections are identified, and increased disinfection of all high traffic areas. So that's the work of the university to make things safer in this era of COVID. But equally important is the work of every individual in the university community to adhere to these guidances and to do what you can to keep everyone around you safe. It is critical that each of us respond sincerely and honestly to the screening questions daily. And if you feel sick, stay home. We have to wear our masks and maintain distance at all times on campus. And there remains an option at all times to work and study remotely without penalty. And that's how we will support each person in their daily decision about whether or not to come to campus. With that, I'd like to turn it over to Michael Ford to talk to you in detail about the changes to facilities and protective measures that have been put in place.
Thank you, Melissa. So the first thing that will come, that will be new to campus when you return is a new app. So we've developed an app to assist with your return to campus. And you can't see it all on the photos here, but you'll be able to click on the app by campus. So you can see Schaumburg, you can see Chicago, you'll see Peoria and our other campuses as well. And each one of those features has specific details for that campus. How you can find a lab, certain alert updates, wellness procedures, etc. By campus on that app. And we'll have the download instructions for you available prior to the return of campus. One of the most important features on the app will be the daily assessment that Dr. Hogan referred to. This is a dynamic feature that once you enter your temperature every day, that dynamic little green circle with the check will actually be in motion. That's the little signs that you can see there. And that color will change on a regular basis. So you can't screenshot it. It has to be something that is live that campus safety will check every day. And if you're a visitor to campus and you don't have the app, we will have touchless temperature testing that will take place, along with some questions that you'll need to answer when you enter the facility. That's depicted here on the picture. In addition to that, we will be distributing face coverings at all campuses. And the face coverings will be provided by campus safety. So you'll be able to pick that up when you come to campus. Now, if you lose your mask or you forget it, you'll have to purchase another one. We're only distributing one to every faculty, staff, and student at the university. Face shields will also be available to employees that are public-facing employees. So if you are working in a high-risk traffic area, reception, or if you're in the classroom teaching as a faculty member, face shields will be available to you in addition to the mask. You can pick up both. Once you come to campus, it is a new day. It will look totally different. When you walk in the campus, you'll see a lot of stanchions, signs, directional signage on the walls, on the floors, directing you where to go. It will be a true maze. But this is all for our safety and to help manage the traffic flow in the university. As you know, we have some restrictions in our very tight lobby spaces, our elevators, and our stairwells. But to help us navigate that, we will have signs and things posted throughout the university, as well as audio. So you'll hear a very familiar voice possibly when you walk in on our elevators, as well as in the lobbies. Here's a picture of some of the signs that you will see. Now, these will be all over the university. We'll have floor markings on the floor, so you'll know where to stand, which direction to walk, keep to your right, certain things of that nature, going one way only, one way out. And then same way for the elevators. Once you go into the elevators, in the Wabash building, the elevators will be limited to 5 people per car. And that's clearly marked in the elevator. And then in the auditorium building, it will be 4 capacity to a car because the elevators in the auditorium building are a lot smaller. And you have to maintain social distancing in every aspect of the university when you're going from classes to the cafeteria to the library, when you're in a lounge area and whatnot. So here's an example of some of the elevator markings that you'll see. And there's audio and things that you'll hear in there, in addition to having containers where you can have disposable wipes. So once you get into the elevator, you actually might hear something that sounds like this.
Five-person maximum occupancy. Please stay to the right while walking and remember to wear your face mask.
So in addition to that verbal prompt every day, you'll have signage in there. Cafeteria. Cafeteria is restricted in terms of the capacity, and we're also using the cafeteria as overflow for our lines. As you all know, our second floor of the Wabash building is one of the highest traffic areas, and it's also the main floor that connects the auditorium building to the Wabash building. So in order to navigate that space, particularly the second bank of elevators that go 1 through 6, and then the elevators that go 1 through 14, some of the lines will begin actually in the cafeteria, and that will be clearly marked on the floors. Now, this photo was taken a little bit earlier, so you can't see some of the directional signage that was completed yesterday, but that will be clearly marked on the floor. And I'm going to show you a few of the spaces that will just have some examples for you to see. So this is the Feynman Lounge. As you can see in the Feynman Lounge, for example, there's directional signage for the traffic areas, and then the seating capacity has been reduced significantly to implement the 6 feet distancing. Library, same way. The library has been divided into quadrants, and they will have a maximum capacity in each quadrant. And that is the same setup where you might have only 2 people at a table at a time and a constant rotation there. There will be monitors and people to help you in the library know where to sit and if you have questions with directions and services. Classrooms. Here's a good example of a Wabash classroom. If you note there on some of the chairs, you'll see some yellow tape. That yellow tape means that that seat has to be skipped. You cannot sit there. For the classrooms, for example, all of them have been reduced to basically a 1/3 capacity. And so that's the way that we are implementing the distancing in the classroom environment. That, you know, we have classrooms of all different sizes. Some of our classrooms are very small conference room that only seat 6 people. And our largest classroom is over 100 in the terms of the capacity. We've reduced all of that down to a 1/3, depending on what class you're in. and you'll know where to sit, clearly marked when you enter the classroom in any building. So that's a Wabash example. This is a Schaumburg classroom example, and I think we might even have an auditorium example if I didn't pass it already. Campus facilities in terms of cleaning. We have a lot of hand sanitizer to go around, and we've ordered a number of supplies. And we have a new system that will help us with disinfecting. So cleaning will take place as it normally does, but we're also using a disinfecting substance to clean our rooms and offices on a regular basis. Here's an example that you can see in terms of one of the offices. So the e-mist sprayers quickly treat the room. We'll do that every evening. So every day when you come back, you'll have a fresh classroom to go into, the bathrooms and whatnot. Now I want to turn it over to Lois Becker to talk about academics. Lois? Sorry, Lois, there you go.
Good afternoon, all. Yes, academics and a mode of instruction. We have met together, the chairs and deans, on a weekly basis, as well as the Academic Reentry Committee, whose names were listed at the beginning of this presentation. And basically, we have the following, definitions for the different modes of instruction. We have some programs that were online from the beginning. That is asynchronous. You can meet, the classrooms, the courses are totally online. There is no requirement to meet at a particular time. Therefore, they are asynchronous. Those will continue. We have remote classes, and I might say that the majority of our courses are going to be remote. And that means that at times they will be synchronous. We will be meeting by Zoom, and most of the course materials will continue to be on Blackboard. When those courses meet are dictated by the schedule, so that if the schedule says that this course meets from 1 to 3 p.m., that is the time period within which the Zoom meetings will be held, whether they're held for the full 1 to 3 p.m. time slot or for a portion of it. They won't be held outside of that time portion in order to mitigate any possible conflicts of times from different courses that students or faculty have. Then we've determined that certain classes need to be face-to-face. For the most part, these are clinics, these are labs. And those courses, as Michael Ford has shown us, will be socially distanced, will be cleaned, etc. The course finder is available now. It is updated with all of the fall 2020 course attributes that define what type of course every single course is. So it will be easy to determine. I also want to say that the face-to-face courses are going to be videoed. And so if someone signs up for a face-to-face course, but there's someone in their household who's not well, or they do not feel well, they need not come in. There'll be no penalty. The course will be available. It will be videoed, and they can participate in the course in that fashion. Now I'd like to introduce Jamara Orr, our Vice President for Student Affairs.
Good afternoon, everyone. So glad that you all could join us. I want to share a little bit of information about housing and how we're thinking about COVID and what we'll be asking our students to do. As Dr. Hogan shared at the beginning of the meeting, we will be requiring all students who are living in housing to obtain a negative COVID-19 test prior to moving in their assigned room. That test has to be dated no more than 5 days prior to their move-in date. For a student who can't get a COVID test, because different cities and states have different rules in terms of who can and cannot get a test, those students will move directly into the isolation floor on the 19th floor and will go to a Chicago testing site. We provided the location for those in the presentation to obtain a COVID-19 test. Once a negative test is received, they will be able to move to their permanent room location. Additionally, many of you may have heard that the city of Chicago implemented an emergency travel order, which required residents of several states to quarantine for a total of 14 days when they're returning or coming to Chicago. And Roosevelt, of course, has to follow this policy. So all students who are traveling from one of these states will be required to confirm that they quarantine for the mandatory 14 days prior to being allowed to return to campus. And they will have to reaffirm this daily until the order is lifted as part of the app process. The current list of quarantine states, FAQs can be found on the City of Chicago website. I'd also like to talk a little bit about the housing contract. So flexibility is really important for us this academic year. We want to make sure that families and students have the most options available as possible. So if you signed a housing contract, you're able to cancel that housing contract at 2 periods in the academic year. The first is prior to your move-in date in fall, and the second is prior to the start of the spring semester's move-in time after winter break. So at either of these 2 periods, you can cancel your housing contract at absolutely no penalty and you receive a full refund. If you do not cancel at one of these contract break periods, the housing contract normal cancellation periods will apply, and as well as the meal plan, those contract cancellation periods will apply as well. So make sure that if you're thinking about canceling, that you do so before move-in, or if you come in fall and you decide not to stay for spring, you can cancel before the spring semester starts at, again, no penalty. Lastly, I'd just like to talk a little bit about what the student support options will look like on campus. So we will have a virtual healthcare group that allows for 24/7, 365 virtual medical care for all of our students to use as much as they need. Additionally, we've partnered with the Center for Personal Development to offer increased counseling services to our students who are on campus. This will include counseling that's offered 7 days a week at a much greater capacity than we've been able to offer on our own. Additionally, we'll be providing COVID-19 testing on campus. More information will be coming out about exactly how many per week and what days per week we'll be offering that testing. And then lastly, all reports of COVID-19 will be required to be submitted to the Dean of Students office if any student has been exposed or is exhibiting symptoms. And then the Student of Concern Committee will work with that student to determine whether or not they need to be in isolation, quarantine, or how to make sure that they're getting the adequate care that they need while they're in isolation and in quarantine. With that, I thank you so much, and I look forward to taking your questions, but I'm going to turn it over to Toya Stewart, who's going to share a little bit more information about human resource policies and procedures.
Thank you, Jamar. Good afternoon, everyone. So there's an expectation that all offices will maintain the established work schedules that we have now, as well as employees have the ability to work from home. So this week, your vice presidents and deans will be meeting with their teams to review work schedules and expectations. And that information will be sent over to IT, HR will have it, and we can better anticipate how many people will be on campus and will be in the office. As with all illnesses, any reporting for COVID-19, typically it goes through the supervisor and will be reported to HR. As soon as we receive report on an employee that is ill due to COVID-19, we will start an investigation, and that's called contact tracing. So HR will begin this investigation, contact the employee. It's very important for us to learn from you. Again, who have you been in contact with? We have to notify other employees of potential exposure. We will also share with you your obligations to quarantine and remain off campus. And we will be in contact with you during that process. We will also provide resources and connect you with any services that you might need. So if you are experiencing symptoms, we do ask you to report that to your supervisor in HR, and then we will follow up with you. It's very important that you do this. Medical information is maintained. So if we reach out to you during the course of the investigation to better understand, who you were around, we will maintain confidentiality. So we will, state things of, maybe the location, you may have had contact with that person, or the timing, but we will not share information about that employee's name and specific information, regarding the illness. So we appreciate you working with us in advance. And I'm happy to introduce Mike Cassidy, our Vice President of Enrollment Management and Athletics.
Good afternoon, everyone. I hope everyone is doing well. I will provide a brief update on athletics as we are now just a few weeks away from the start of the fall academic term. Earlier this month, we did receive guidance from the NAIA, the National Association of Intercollegiate Athletics, the national association that governs a majority of our intercollegiate athletic programs. They provided us with some baseline guidelines and protocols that our athletic teams must follow to safely resume athletic participation this fall. And I really want to focus on that key component, that all of our plans regarding athletics are to do so in a way that keeps not only our student athletes, coaches, athletic department staff safe, but also keeps our community safe as well. From that guidance, we layered in the work of the Return to Campus Committee, which created some broad institutional guidance. And we have begun the crafting and are near finalization of a return to activities plan that is very specific to our athletic department and our student athletes. This will, as the next bullet point references, kind of outline what our season schedules will be. It will be both very detailed, and it will also provide our student athletes with some assurances in terms of what the screening protocols will be. It will outline how we will practice. It will outline how we participate in games and competitions. It will outline how we travel, and provide many of the details that I'm sure many the individuals that are participating in today's information center are desiring. We are, though, waiting for some final guidance from the NAIA in terms of return to play this fall. We are anticipating getting that by the end of this week, and from there we can finalize our own institutional return to activities plan. This plan will not be a static plan. It will evolve just as the public health guidelines evolve. Just as we begin to resume athletic participation, we will learn things as part of that, and we will evolve our plan to, again, assure we are keeping all members of our athletic department and our institution and our local community safe. Related to testing protocols, the NAIA, as part of its guidelines, has mandated that every student athlete must be tested within 5 days of their first competition. Our student athletes can anticipate a test requirement prior to their first practice as well. That will be similar to the requirement of moving into residence. This is something that your individual sport coaches will be outlining to you in the days and weeks ahead as we ramp up to the start of our fall sports seasons. There will be a lot of information shared moving forward. Again, this is an evolving topic as we finalize our plan. But what I really want to do first is show appreciation to all of the members of our athletic department for their tireless work in creating a plan that will allow potentially for the safe resumption of athletic activities this fall, but also for our student athletes, both current and those that will be joining us this fall, for their patience as we kind of navigate the ever-changing public health guidelines. And from here, I will now transition it back to Dr. Ford, and we will begin our question and answer session.
Okay, our first question is, what will be the best kind of mask or face covering? Melissa, would you like to take that?
Absolutely. That's actually a really good question. And I appreciate that being asked. First of all, there will be, as Dr. Ford said, a mask provided to each member of the community when you return. It is your option to wear that mask or some other face covering of your choice. The absolute best face covering that you can choose is the one that you can keep fully on your face the entire time that you're on campus. So find something that's comfortable, find something that you think you can wear. I actually carry a couple different face coverings with me. So I'll wear maybe a homemade ear loop mask, and then I'll also bring a buff that goes around my neck. When my ears get tired, I pull that ear loop mask off and I put the buff over my face. If I need to have a mask on for a long time, I'll plan ahead to do that. I encourage everyone to view this as part of your style ensemble. So, you probably want a mask to match your outfit. There's probably sportier masks and fancier masks. I'm sure Dr. Becker will lead the way in the fashionable mask department. There is only one kind of mask that I would ask that everyone avoid, and that is those valve masks. They have actually a valve on the side, which allows your droplets to leave your mask unimpeded. That defeats the purpose of the face covering. Keep in mind, as Ali said, we are wearing our masks for each other. It is a show of strength and solidarity that we wear these masks, and the masks are there to protect those around you. So you need to wear a mask that keeps your droplets out of the airspace around you. It's been shown in multiple cases where people have been later confirmed to be COVID positive, where they've been in spaces prolonged times with masks on and have not transmitted infection. This is really, really paramount to our success in reentry. So again, any mask, a surgical mask, a homemade mask, any fabric mask that you choose is perfectly fine as long as you keep it on. Thank you.
Michael, you are muted.
Can you hear me now? Sorry about that. Can you hear me now?
Yes, we can.
Okay. So the second question, if we test negative for COVID during the quarantine, will we still have to stay in quarantine? Melissa or Jamar?
I can tackle that one. So it's important to know that these are two different requirements. The testing requirement for residential students, that students must have a negative test before moving into their permanent residence hall, is a specific Roosevelt policy. And so if you have a negative test underneath that policy, no, you do not have to go into an isolation floor. But as it relates to the City of Chicago policy, that is independent of whether or not you have a negative test or not. The City of Chicago has said if you're coming from one of those states, you must be in quarantine for 14 days. And that quarantine must happen prior to arriving on campus. For our residential students, you received an email yesterday that kind of outlined this requirement and what students need to do. But it's important to note that the City of Chicago quarantine order applies to more than just residents. This is our commuter students, this is our faculty, this is our staff. If you've been to one of these states, you are required to quarantine for those 14 days. And we know that this poses a challenge for many of our parents, students, and families, and we're happy to have conversations around different ideas and different ways that you all can facilitate this. But I did want to clarify that those are two distinct policies, and a negative COVID-19 test as it relates to the residents moving into the halls doesn't have anything to do with the City of Chicago quarantine order that requires the full 14-day quarantine prior to coming on campus.
And if I could just add to that, in addition to the quarantine order from the City of Chicago and the negative test requirement for coming back to campus, there is a component of contact tracing. If you've been in contact with someone who is diagnosed, you do have to quarantine for 14 days. Provided you're symptom-free, then you can return to campus. But a negative test during that phase also does not eliminate the quarantine requirement. And this is CDC guidance. So a negative test doesn't necessarily mean that you won't test positive a subsequent day. So we really do have to have that 14-day quarantine, even if you also test negative during that time.
Okay, thank you. Is a negative test required prior to a sixth student returning to campus? Melissa, would you like to take that one?
Sure. So this is related, but again, this is someone who has been diagnosed. So whether it's a student, faculty, or staff, if you have been diagnosed by your provider or via a test with COVID-19, per CDC guidance, you must isolate for at least 10 days and until you have been 72 hours without symptoms. So that means no fever, no use of any fever reducing medications. You must also, to return to campus, provide evidence of a negative COVID test. So you can do that through your provider or through one of the free testing sites, but you will be required to provide that either to the Dean of Students if you're a student or to HR if you're an employee to be permitted back on campus.
Okay. Jamar, it looks like the next couple of questions might be for you. So if a test result is taking more than 5 days to be returned, what do we need to do so our freshman students will be allowed to move back in?
So I'm glad they asked that question. A student will be allowed to move in if they have not taken a test that's dated within 5 days. However, they won't be able to move into their permanent housing room. They'll be allowed to move into the quarantine floor until they can obtain a test that is within 5 days that says that they are negative for COVID-19. So no student will be turned away, but they will just be sent to the quarantine floor.
Okay. How will freshman orientation be handled? Will it be face-to-face?
Freshman orientation will be mainly virtual. Given the nature of COVID-19, we really wanted to lead with safety as the #1 issue. And so most of it will be provided virtually. However, we know that some students will be in the residence halls at the time of orientation. So we're making provisions for those students who might have a desire to come together to participate in some of the sessions in person. But as always, they will be required to have on masks, and we'll be following social distancing guidelines as well as capacity limits for any rooms that we're utilizing for that. For any student that has that desire, they'll need to communicate that in advance that they have a desire to be in person for any portion of orientation, and then we'll make the appropriate accommodations. An email will be coming out next week to students talking more about orientation.
Okay. Will the RAs host activities for those living in the dorms?
Yes. So the RAs have been a buzz working on different programming initiatives and ideas that they can do both virtually and in person. The vast majority will likely be online and virtual, but there will be some in-person programming activities. But again, masks will be required. We'll be following social distancing as well as capacity limits on the room. So you should expect upon your return to the residence halls that there will be an element of campus life, fun, and engagement in the residence halls.
For the few classes on campus, how many students will be in each classroom? And I'll take that one. Just like the slides that I showed you all a little earlier, all the classes are different sizes and they are clearly marked. And basically the best way to look at it is it's about approximately a third of each class maximum capacity will be allowed in the room. So we might have, for the most part, somewhere around 10 students, maybe no more to exceed 20, depending on the size of the classroom. Again, we have very small classrooms that are, let's say average 20 or 30, and then we have them all the way up to 100. So for the most part, you might be in at least 1/3 of the class size for that. What procedures will be available for the fitness center to reopen? And right now, we're currently assessing whether or not we can safely open the fitness center. And as we go through that process, we'll make sure that if we decide that the fitness center is available for use, that will be posted and that information will be available with any restrictions that are appropriate for the use of the facility. But that is to be determined. What spaces will be available for students to use on campus when they aren't in-person classes? Will it be classrooms, library areas set aside for quiet study, internet access for those who need it? Yes. And so the way that we're doing that is that we will have, in addition to our lounge areas, that are set up to ensure a safe distancing. We're having a couple of classrooms set aside as study rooms, if you will, for students to go into if they're here for a face-to-face class and then might have their next class online virtually, that they can do that on campus, as well as go to the library and other resources. So you'll be able to possibly use your app for some of that, but there will be additional capacity on campus for you to stay and study and work remotely without having to return home. If a student or an employee is deemed high risk, what protocol is advised? Melissa?
Sure, thanks, Michael. As we've said before, this is really an individual decision. So if you are high risk, if you believe that you are at risk for severe disease, if you perceive that you just don't feel safe coming to campus, you have the right and the option to make a decision to work or study remotely. So if you're an employee and you believe that you should work remotely, you need to work with your supervisor. You will be supported in that. We've all been working remotely for months now. We've figured out how to make it work. So we will continue in that way for those who need to be at home. Likewise, if you're a student, you can progress successfully remotely. So if you have questions about this, about your academic progress, please reach out to your advisor, work with your faculty if you're already, if we're partway through the term and you're enrolled in a course that's face-to-face and you can't come anymore, as Dr. Becker said, that course will be available to you remotely, and you can do that. So please make those decisions, and you will be supported if you need to refrain from coming to campus at this time.
When will fall 2020 course finder be live? Katrina or Lois?
It's me. It's live.
Okay.
And so if you have not registered yet, please register. If you have any questions about how to register, I know some of the RMEC students, this is a new process for them. You are welcome to reach out to your individual academic advisor, or you can email the advising center at advising@roosevelt.edu, and someone will be happy to help you. We'd love to get you registered. We're here to help.
Okay, good. If we have someone at home with underlying health issues, what can be done to keep them safe, and me as well? I commute to school via train, so I could potentially expose them due to all the contact I have with other people. Lois? Or Katrina, either one.
Yeah, I think perhaps Lois's internet went out. So faculty, again, I know Melissa said this and perhaps Lois earlier. Again, the key is being safe, and faculty have been asked not to require students to attend in-person sessions if they are not comfortable, and to make arrangements with students to provide an equivalent experience. So if you're uncomfortable, just speak with your faculty member. That's all that we ask, and they're going to make accommodations for you accordingly.
Okay. How will accommodations for students with disabilities be addressed with respect to classroom instruction and assignments given?
Sure. All classroom accommodations will remain the same. A new in-person testing policy is being created to ensure that students taking an exam can do it in an appropriate time frame while still allowing to maintain social distancing with the proctor. For online courses, accommodations will vary depending on the type of accommodation given. If a student has questions as to how a specific accommodation will look with an online course, anyone can reach out to Kathleen Mullins. She's in the Learning Commons. She's our interim director of the Learning Commons at kmullins01@roosevelt.edu right now. Again, kmullins01@roosevelt.edu, and she's happy to give you very program and individual student specific information.
Okay. What happens if the city of Chicago moves back to phase 3? Melissa?
So if the city of Chicago moves back to phase 3, all face-to-face classes will go remote. just like we did in the spring, although probably in a much more organized fashion. So that is the plan. Student housing will remain open, but classes will go back to remote delivery only. Any skills lab-based courses, if they cannot be delivered because we've gone back to phase 3, they will be just put off until we go back to phase 4 and we can be on campus again.
What are your criteria for closing down school and sending everyone home?
Yep.
Melissa?
May I take that one?
Sure.
Okay. So we will be monitoring positive cases. I think you've heard, we want positive cases to be reported to either the Dean of Students or HR, and their offices will be reaching out and doing contact tracing. We will be doing our absolute best to monitor and keep track of all aspects of positive cases. We will be working with the Department of Public Health, and it will be actually their guidance that will tell us if we need to change what we're doing. So if we need to, even if Illinois is not in phase 3, but we have a high rate of cases, and the Department of Public Health tells us we need to go to remote instruction, we will. But that's a decision made in concert with public health guidance.
Okay. Being at the front of the lines, I want to know how to protect myself without becoming an enforcement police. Let's see, how strict will the university be in enforcing the rules? Melissa, have you take that one again?
Okay, so first and foremost, we are asking for cooperation across the university for everyone to adhere to all of our practices that will help keep us safe. And we expect that everyone will comply. It's possible someone might come in and forget their mask and they'll be told to purchase one or go back and grab their mask. If you are someone who does not want to wear a mask and will never wear a mask, please do your work or studying remotely. Our campus is a mask campus. Likewise, we require social distancing. In the event that someone really isn't complying with these expectations, this will follow the procedures that are used whenever someone doesn't comply with policies that are required of our students and our employees. So if it's an employee failing to comply, it will be reported to the supervisor, and HR will conduct its investigation and work with the supervisor regarding penalties. Likewise with students, that report goes to the Dean of Students and the Code of Conduct process. It is our hope that we don't have to institute any consequences for folks, but the most simple and direct consequence will be a lack of access to campus. And that's not a true penalty because you will be allowed to work, you will be allowed to continue with your coursework, but you'll just have to do it remotely. We are hoping that we'll help each other comply. So, if you see someone with their mask around their chin, just give them a gentle reminder. It can happen to any of us. I found myself walking out the door this morning and I didn't have my mask with me. And of course I have 2 backups in the glove compartment, but I ran back and got my mask. If I come in without a mask, please assume that, I forgot it. I expect security to stop me at the door and not let me in, and we'll go from there. But it's going to take cooperation. It's going to take constant effort and attention by all of us, and a respectful request that we all comply with this expectation.
Is there going to be a delay in the fall season sports, Mike?
Yes, because we've already received some guidance that has delayed the starts of our NAIA programs. The NAIA, as part of its initial guidance, delayed the start of anything that could be considered a practice. The first day that could occur is now August 15th, with no competitions allowed to take place against other opponents until after the 1st of September. So that has already pushed back what was usually allowable in terms of practices beginning after the 1st of August. So this will have an impact on some of what used to be early move-in schedules, et cetera. And those are being adjusted accordingly based on these new guidelines from the NAIA. Many of you, though, might have seen other associations, other individual institutions, other conferences already postpone or delay fall activities in totality. That is not the current plan for Roosevelt or the NAIA, but we are continuing to look at public health guidelines and will adjust our schedules accordingly if it is deemed those activities cannot persist in a safe way. But what I do want to do is assure all of our student athletes that should the fall season be disrupted, this will not negatively impact your athletic leadership awards or athletic scholarships that are a part of your financial aid package. Those will be honored irrespective of any changes that might get made to the fall schedules. Similarly, we understand that some student athletes, if the return to activities plan does not meet their level of comfort to re-engage in athletic activities, we understand some students might not feel safe returning to activities this fall. Those students can choose to focus on academics, continue to engage in the institution and pursue their academic interests remotely. And again, their athletic aid will be honored through the fall semester because we want them to make the best personal health decision for them as we navigate this coronavirus. With that also, I just again want to remind everyone that the fall schedules are fluid right now, and we are monitoring them on a daily, if not hourly basis to make sure we are in alignment with our conference, the Chicagoland Collegiate Athletic Conference, the NAIA, as well as our other associations, including the ACHA, the MSFA, the United States Bowling Congress, our esports associations, et cetera, to again ensure we are in alignment to deliver fall activities in a safe way, but also in a safe way that's in alignment with our institutional policies.
One more question, related question for you, Mike. Are friends and family allowed to attend the games?
As of our current return to activities plan, we will not have fans at our home athletic events. We understand that, the attendance at these events is important to our friends, family, supporters of the Roosevelt Lakers. So what we are looking at doing is really expanding our online viewing capabilities of providing live streaming of as many of our home athletic events as we can. We understanding though that we primarily compete in facilities at which we do not own. We rent and or lease a lot of our both practice and competition facilities. So this is really one of the main reasons why we are limiting fan access, because we do not have complete control of those facilities before and after we access them. But also we think though that we will be able to provide live streaming of a lot of our home athletic events, which will provide a viewing opportunity for our friends, family, and supporters of the Roosevelt Lakers.
Great, thanks, Mike. And thanks to everyone for participating in the Q&A here and also in the info session. This was designed to give some brief overview information that we know a lot of people were looking forward to hearing and anticipating. But we know that this was not a deep dive. So we will have some additional sessions coming up. So I want to show you these upcoming info sessions and encourage you all to participate in those sessions so we can have all your questions and concerns answered. The first one that will be coming up will be the athletics one on Monday, July 27th at 12. So this is for students as well as their families. So parents should chime in on that as well. Academics and course management, that's for faculty. That'll be on Thursday, July 30th at 12 p.m. Using the Return to Campus app for students and faculty. So that one, I really encourage everyone to attend. There will be a lot of features in there. We'll have recordings and things for you to follow up on, but if you can go to that to get your questions and concerns answered, that will be great. Current students and campus and residence life for current students and family members. So there are a lot of questions about the return to campus, particularly when it comes to residence life in our living facilities. So please join that conversation on Wednesday, August 5th at 12 p.m. And human resources, protocols and procedures for faculty and staff. Again, a lot of things that we need to know in terms of how do we operate when we're on campus to ensure everyone's safety. And also volunteering on campus. In order for this to take place, everyone will need to be involved in the community above and beyond our regular workday. And so to help manage and navigate the traffic throughout our facilities, a lot of us will be volunteering to help everyone kind of, with the flow and any questions and concerns you have when you're here all day. Okay, so thank you again for that. Registration links will be available this week on Roosevelt calendar. Reminders sent via email on Friday. And this session is also being recorded and will be on YouTube in 48 hours. All right. Again, thank you everyone for joining in the session, and we look forward to seeing you soon. Thank you. Take care.